Hello, everyone. Welcome to the USC Institute on Inequalities in Global Health virtual lecture series. My name is Sophia Greskin, and it is my great pleasure to welcome you to Global Pandemic Prevention, Preparedness and Response, Negotiating the Future. And this event is done in partnership with Spark Street Advisors. And I think I speak for both of our institutions that we really enjoyed thinking about this together. And so on our collective behalf, let me say welcome. I wanted to say a few words by way of framing, and I guess I want to say something about COVID, the pandemic that we're all most familiar with. Because as I think everyone here knows, it's been 3 years since COVID was declared a public health emergency of international concern. And for those of us in the US, I just need to emphasize that COVID isn't over. It's still a public health emergency of international concern. Cases and deaths are still growing in a number of places, and globally, vaccine inequity remains a huge problem. The most recent data, February 1, says in lower income countries, only 1 in 3 people have been vaccinated with at least 1 dose. And I say that even as the United States has just announced plans to end COVID emergency declaration in May. So not only is COVID not over, but in terms of the future, there's talk this week, as I think everybody's been seeing this week, about bird flu and basically just the reality of more and more new viruses traveling at crazy speeds across the world. So we all have to be prepared for the future, even if frankly, it's super unclear what that means. I mean, at a structural level, what COVID did was to expose something that had always been the case, which is the fundamental weaknesses in pandemic preparedness and response from within our countries, but also at the global level. And I'm talking about the range of things where I think there is agreement that are needed to address pandemics: financing, surveillance, epidemiological surveillance, intellectual property issues, vaccine development, distribution, access. All of these require coordinated global political leadership. But what it will take to get us there and what's going to be needed to address pandemics going forward is really kind of the subject of what we're talking about today. So as we're going to hear, the independent panel for pandemic preparedness and response that had been established by the WHO Director General was established to conduct an independent comprehensive review on insights and lessons learned from the health response to COVID, as well as previous health emergencies, and to provide a fresh assessment of approaches to the challenges ahead. We're very lucky to have 2 members of that panel on our panel today. And their conclusions form the basis for much of what we understand collectively to be the issues that will need to be addressed. And the World Health Assembly, the decision-making body of WHO, established the Intergovernmental Negotiating Body to draft and negotiate a new legally binding WHO convention, agreement, or other international instrument on pandemic prevention, preparedness, and response for member states to work together to strengthen the world structures and systems. And that's the body that Dr. Matsoso currently co-chairs. So I just want to say we have an amazing panel. Honestly, I couldn't ask for a better panel of leaders to be in dialogue with one another. And I'm going to introduce everyone super briefly, but I'm asking you as the audience, please look at their full bios on the website. You'll see it's an amazing group. I'm not going to do anyone justice. And so please do look as I go through these very brief introductions. So first, we have Precious Matsoso, who's currently the co-chair of the Intergovernmental Negotiating Body to draft and negotiate a WHO convention, agreement, or other international instrument on pandemic preparedness. She was a member of the independent panel, as I said, and amongst her many, many accomplishments, she served on numerous advisory bodies. She served as chair of the WHO Executive Board, as Director General of the South African National Department of Health, and we're very honored to have her with us here today. So thank you for being with us. We have Leigh Thambali, who is an analyst focusing on global health governance at Spark Street Advisors. And his current work is focused on tracking developments in the governance of pandemic preparedness and response, and analyzing how independent monitoring could promote compliance and accountability in the proposed treaty. So perfect for our panel today. He's also a researcher in community health at Birzeit University, and he's worked as a researcher, a public health practitioner, a doctor in many, many parts of the world. Next, we have, and I'm going around my screen is how I'm doing this. We have Michel Kazatskin, who has over 35 years of experience in global health. He's a leading physician, researcher, administrator, advocate, policymaker, and diplomat. And he's played key roles in so many organizations, including serving as director of the National Agency for Research on AIDS in France, the French ambassador on HIV and communicable disease, executive director of the Global Fund, and also as a member of the independent panel. And he's currently special advisor to the WHO Regional Office for Europe. And last, but certainly not least, we have Nitin Ramakrishnan, who is a consultant with Third World Network, an independent nonprofit international research and advocacy organization involved in issues related to development, developing countries, and North-South affairs. He's taught international law and global governance, and admirably quit a tenured faculty position to follow these WHO negotiations, specifically the international health regulations and this new pandemic instruments. So you can see what a panel. So please, as an audience, if you could drop any questions in the Q&A function, I will come to your questions at the end. And I'm going to run this in terms of just raising a series of questions to the group as a whole and hope that everyone can and will engage. So just to start, maybe to help orient everyone, I'm going to start from the macro with a big question or kind of set of questions just to get us started that I would really appreciate everybody's take on, which is really about the range of issues, modalities, mechanisms you see as necessary to address pandemics going forward, what we can learn from our recent history, from HIV, from SARS through to COVID. What are really, I really want to kind of open up the global mechanisms already in place, even if they're perhaps underutilized or inadequate, like the international health regulations. What are some of the efforts that have been made to take us to today, considering the independent panel? And ultimately, really what I'm asking is, what do you see as the goals for global action on pandemic prevention, preparedness, and response, and the modalities? And Precious, may I start with you?
Yes, of course. And I must declare upfront. Can you hear me?
Yes, absolutely.
Can you hear me?
Yes.
Okay, I'll keep on asking whether you can hear me because we've got power outages in my country. So if I disappear, just understand that I'm using my dongle to ensure that I stay connected. But thank you so much for inviting me. You know, I can safely say that, you know, we have COVID pandemic, and we've had other disasters, and Africa has been worst hit in that with Ebola. You know, some may have viewed it as an African problem, and held back and did not make necessary investments. We've seen with COVID, and one would have expected that when we had Ebola, that there would have been significant investments in preparedness, prevention and preparedness. Now, coming from South Africa, you know, we've had the biggest HIV/AIDS program in the world. But if you go back historically, some of the problems we're confronting with COVID is what we experienced with HIV/AIDS. Problems of equity, access. These have been ongoing debates. I was drawing a parallel, saying, you know, in South Africa today, if it wasn't because of solidarity, if it wasn't because of some of the actions we had, and some of the legal battles we had to confront, we wouldn't have had 6 million people on treatment today. And I can say that today we've lost more than 6 million people. And I was drawing a parallel. We have COVID. We've lost 6 million people in the world. And during COVID, and I was drawing a line in South Africa, we saved 6 million people because we're able to intervene, though late, but at least were able to put 6 million people on treatment. Now, there are key issues which I consider as lesson learned. One is that what I've seen with the AIDS response, what I see now with COVID, is that the multi-sectoral response, I think, is at the heart of every response across the world. And we tend to want to negotiate this multi-sectoral response when we've seen that it's worked elsewhere, and it's a necessity. It has to be central to how we put together governance mechanisms. As you know, we identify 4 thematic areas, one on equity, governance, finance, systems, and tools. And these themes, cut across actually every aspect of prevention, preparedness, and response. And it is important that, particularly with equity, that it's not just, an aspirational, ideological debate. We must embed it, and we must ensure that it's both a principle and an outcome. And we must have some form of measurement to ensure that we have achieved equity. And the lessons from the HIV/AIDS process are quite significant in that they came up with some measurements, 80-80-80, 90-90-90, 95-95-95. We need to have a specific measurements that can be the basis on which we say, yes, there are investments, yes, we are prepared, yes, we can respond better. And I can talk about at country level, those are significant. And perhaps we can talk later about globally, what does it mean? Thank you.
Thank you very much. Thank you. Who would like to go next? I'm going to go around my screen if that makes sense. Laith, would you mind responding next?
No problem at all. I completely agree with everything that Precious said. And can I just say thank you so much, Precious. In particular, I know everyone on this panel works really hard. I think Precious works the hardest, and so I'd like to give her a bit of a shout out and really thank her for the amazing work that she's doing, the amazing work that she did on the independent panel even before that, and then also as co-chair. I think I really just want that recognized to our audience, listeners today. So I'll just open with that, and thank you for what you just said as well, Precious. I completely agree with everything you just said, and I just want to kind of elaborate maybe a little bit further on that, and really emphasize this point that we seem to be in these repeated cycles, and it's not as though we haven't been discussing many of the solutions, not just even for pandemics, but for lots of different, not just health challenges, but also social and economic challenges as well. When we're talking about health system resilience, when we're talking about whole of society approach, whole of government approach, we're recycling old concepts and just kind of maybe sometimes packaging them in new language. A few years ago, it was overcoming silos. In Alma-Ata, it was state is a state, health is a state of complete, even before Alma-Ata, I was talking about the foundations of the World Health Organization, health is a state of total well-being and covering, even spiritual aspects of well-being. So all of these ideas about systems underpinning whether we are healthy or not healthy, whether a pandemic hits and we die or don't die, all of these things have been discussed for a really long time. So it's good to see that there is this evolution of terminology. Preparedness is being discussed in a different way to what it was being discussed as about 15 years ago and even 5 years ago. We're seeing, everyone is now talking prevention, preparedness, and response. That's now really well embedded everywhere, and that's really good to see. And we're seeing recovery being added in as well in lots of places. Now, what these tell us is that there is this increasing recognition of, and response is also being discussed in a different way, talking about engaging different factors. So we're seeing an evolution in how we're looking at pandemics, but it's not new. And I think that what this tells us is that we should be focusing a lot less on, and as someone who's obsessed with governance, I don't say this very often, but we shouldn't pay too much attention to the modalities and mechanisms, and a bit more about why are we repeating these cycles? Why have we not been able to shift power in a direction in which we overcome silos, in which we talk about health systems as with the breadth that we're meant to? And I think that it's because we are not only recycling the conversation, we're recycling also the same kind of modalities and mechanisms over and over again, because we're not actually changing any of the structures that we're relying upon with our health systems, but also with our social and economic systems. And I think that we need to think about quite a different approach in order to actually achieve those ambitions around broadening out this conversation in pandemic preparedness and response.
Thank you. Super, super helpful. Nitin, please.
Thank you for the floor. And, let me begin with perhaps my concerns in regards to people suffering from the earthquake in Turkey. Coming back to the question with regard to what do we see as global overall goals for global action on pandemic prevention, preparedness, and response. I would just perhaps try to put it into a little bit context than thinking about global actions, because the rest of most of the questions actually point towards the pandemic treaty negotiations, the instrument negotiations. So I really want to discuss the global actions from that point of view. Like, why are we actually looking at a new instrument, right? So that's basically, we have recognized that there is a gap in legal obligations. Otherwise, we shouldn't actually start thinking about a new legally binding instrument out there. So then the question is, like, what legal obligations do we already have, and what legal obligations we really don't have, and whether that absence or gap in legal obligations has actually contributed to what Ms. Precious, I would say our chair in INB has said about investment, and what Light was telling about repeating the cycle, whether the absence of this legal obligation is contributing to these two issues. I would say yes, because there are at least two important legal obligations missing out there within the international. I would say, of course, it is embedded, but not really explicit and positivist in nature. Picking out specifically in English words. That's how international law works, right? If you have not really said, shall support or shall cooperate and shall undertake to cooperate would differ for for the international lawyers out there. So with that specificity in mind, I would say there are at least two important legal obligations which is missing. One, as of course, is the equity access to health products, technologies, and know-how, which is required to respond in a health emergency situation, not allowing it to become a pandemic, to spread. That's clearly missing. The second is, again, I would focus on the issue of lack of response capacities, because the legal obligations to finance is fluid. It does not prioritize where do we need to invest, okay? And because of which investment always travels the way donors decides where the investment goes. So instead of having a very important health system strengthening in an overall understanding, instead of increasing the resilience of health systems, there has been a historic prioritization of emergency capacities, and within the emergency capacities on surveillance capacities and information sharing capacities. So we really lack primary healthcare or hospital care facilities and capacities, which are important elements in terms of responding to an emergency outbreak, right? So this is a very critical issue, and we need to perhaps address these two gaps through legal obligations. We cannot think about business solutions. We cannot afford to have multi-stakeholder mechanisms which are without accountability, right? So because that's why we call for an instrument. I mean, that's the whole context. If I have not called for an instrument, we could definitely then perhaps think about having more mechanisms, more instruments, Article 23 resolutions, recommendations, partnerships, collaborative institutions. But we have actually decided that we want a legally binding treaty, which means we want obligations in these areas specific, explicit, concrete. So that's where I would start.
Thank you, Michelle. Thank you. That's super helpful.
Thank you very much. I mean, a lot has been said already, and I must say I agree with most of what has been discussed, and particularly with what you, Precious, said in the very beginning, setting the scene. Let me just make a few quick points. The first is that seeing also what's happening today in Turkey and Syria, I'm just thinking that investing in health systems and human resources in order to be capable to respond to global health threats or regional or national health threats is absolutely essential. And prevention and preparedness is really about this. We've heard a bit of global and a bit of country perspective from colleagues. I'd like to say that reflecting on prevention, preparedness, and response should be done at the three levels of national, country level, regional, and we may come back to that. There's now an increasing trend in understanding the potential of regionalization and at global level. My second point is that, as Precious said, a lot of that discussion has taken place for quite a long time. But it's also amazing to reflect on how unable we have been to learn the lessons. Certainly, some of the lessons from HIV, as you discussed, certainly lessons from SARS, when the international health regulations were established, but obviously health regulations were not enough. We saw that in COVID. But then just think in recent times, last week or 2 weeks ago, a paper in the Lancet shows us that there was this outbreak of Ebola in Uganda, and there were effective monoclonal antibodies to the virus available, stockpiled in the US, but the system was unable to move those to where they were needed. And also remember, while we were starting these negotiations and discussions, we had Mpox. And with Mpox, immediately the richest countries rushed and bought whatever vaccine was available, so that the African areas in Africa where the disease is endemic didn't have access to vaccines. So amazing inability to learn lessons. Precious, you may remember our panel said, looking back at Ebola, that out of, I don't know, something like 16 or 20 panels that came with recommendations, after Ebola, only 10% of those recommendations were actually implemented 8 years later. My third quick point is that COVID has taught us, HIV as well, that a pandemic is not just a medical and a health sector issue, but it goes far beyond. It is a societal issue, and the socioeconomic impact of COVID has been very high, and many lives were lost because of the socioeconomic inequities that were underlying the pandemic, that were accentuated by the pandemic, and not only by, deaths from acute respiratory disease. I would slightly disagree with Leth about governance. I think we should focus on governance, because I haven't seen leadership in this pandemic. I have not seen leadership. The Security Council has not been able to have a resolution. Remember, in March 2020, because the US were asking that the virus is called the Chinese virus. And the UN General Assembly has not met until now, and will only meet 4 years almost, after the pandemic. When we look at history and the role of UN General Assembly in triggering the response to AIDS or to Ebola, it is amazing. And the executive board of WHO, it took it 8 months to come together. So we are in a non-governed, complex, fragmented health architecture, and we do need to focus on governance. And maybe the last point is that we enter these negotiations in a very difficult multilateral context. We are not with individualism, nationalism, the competition between US and China, the war in Ukraine. We are in a very fragmented, geopolitically fragmented world, and that is not good for multilateralism. Maybe health is, however, able to transcend that, and that is really my hope.
Thank you for that, and thank you all for that fabulous round in terms of just getting us oriented. I mean, I think I want to move into a quick question where I would just like everybody's kind of quick reflection, which is, given everything that you all have said, how do you think a treaty could be of use? What's the hope of what this treaty can do? Why do you potentially think this is an important modality, right?
Maybe I can start. I had avoided talking about a treaty because I don't want to bring a sales pitch here and come up with a commercial advert for a treaty. And I'm happy Nathan was the one to pitch that. Let me just say that, and I know that you have not put human rights at the center of all of this. If you trace back historically with HIV and AIDS, the structural barriers, to HIV and AIDS and the rise, discriminatory practices that we saw during HIV AIDS have actually, they're actually good lessons for us. We see that with Ebola, how discrimination against anyone who came from the African continent, it didn't matter whether you came from a country that did not have Ebola, but because you just happened to come from Africa, you're discriminated against. We've seen that with COVID, those discriminated practices within countries, between countries, and across different continents where the travel bans were imposed regardless. So I think, firstly, we have to ensure that one of the key principles is on the right to health, gender equity, protective measures against vulnerable groups. So when we look at the gaps and we look at what happened with COVID, you'll realize that certain groups, those who normally do not have access, were the worst affected. So this instrument should ensure that at least their rights are protected. And I'd like to start with that first. And secondly, when we talk about equitable access, as you know, even with HIV and AIDS, it started with those who could afford, could buy medicines for themselves. We see it with cancer, and in future, it will happen with vaccines. Those with funds will pay for themselves out of pocket because they can afford it. I don't think this is the approach to follow. The financial mechanisms, when there's an outbreak, when there's a pandemic, must kick in immediately to protect particularly the vulnerable groups. So for me, if I were to say this, we've succeeded with the treaty, it must be because we have put them at the center and we can protect them. And I agree with Michelle. I mean, I sat on the high-level panel on access to medicines that was established by Ban Ki-moon. We said at the time there was policy incoherence. There is still policy incoherence. And I think with this treaty, we probably need to fix the incoherence and ensure that the legal instrument can bring about legal provisions that can bring about that. It cannot be that, again, decades and decades later, we're still talking about inequitable access. in this day and age. Thank you.
Thank you. Thank you much.
Yeah,
Please.
I thank you, Precious. I fully endorse everything you said. And as Nitin said earlier, I think the value of a treaty, that was Sophia's question, is really in the fact that it will be binding and that policy coherence will be actually set in the international law. Now, once after a treaty is negotiated, and this is the process that is now starting in Geneva, it has to be endorsed, which could happen possibly in May 2024, but then it has to be ratified by countries. It's a very long process, so you may see this as an obstacle. You may also see this as the fact that if a country really ratifies the treaty, it means that it has thought about it in length and seriously. And this is the time to say that the US has still not ratified, for example, the first convention of WHO, which is the Framework Convention on Tobacco Control, 2005, and we're in 2022. So not all countries, and that's a weakness of the system, obviously, but also a sign of, again, what I call maturity in thinking and endorsing. Not all countries have ratified and will ratify that treaty. One other challenge that we're facing is that because the process is so slow, a number of people said, including the US, let's go faster. And to go faster, let's renegotiate some of the articles and bring amendments to the international health regulations. And I can see that some of these amendments brought by the US particularly to the international health regulations will be accepted and will move forward. The question is, will that shake or negatively impact on the slow but truly building process of an international treaty? I don't know, but there is a risk that some countries, and again, sorry, I keep citing the US, could say, okay, we're satisfied with these amendments. Why do we need a treaty?
Yeah, we'll come back to the US in a moment. Yeah, Nitin?
It's with due regards and due respect to what Precious was saying and Michelle was saying, and with the whole, respect towards the kind of intention and good faith going behind in constructing this new instrument, I would try to bit differ from answering this question from them in terms of perhaps looking at this instrument in a little bit rather holistic way, or connected with in relationship with international health regulations existing out there. Because I also see a wonderful question coming from David Peterson in Q&A on similar stuff. Why don't we just perhaps strengthen IHR and go ahead? The question is out there. So looking at the treaty, firstly, I would say we clearly lack fundamentals in the sense like none has so far explained how is a pandemic prevention, preparedness, response and recovery is slightly different from health emergency prevention, preparedness, response and resilience. And some of the civil society organizations put up this question to the review committee on IHR amendments as well. We found them, trying to, answer around this conceptual issue, how a pandemic preparedness is different from public health emergency of international concerns preparedness. So that's the context. If we are not able to explain that distinction, then the whole call for the new instrument would fail, because then it is enough that strengthening of IHR 2005 would be enough. right? But we see then that means we need to establish a very clear objective to the new instrument as different from International Health Regulations 2005. And at least if you ask me, I would see it in the larger scale of what we call as something as pandemic, right? Which means it needs a larger scale, enhanced version of equity, right? It needs automatic triggers. It cannot be, the response to a pandemic cannot be left to negotiations of agreements, either for troops failure or for technology transfer or for transportation of equitable transportation of health products. It should happen just the way US demands for sharing of information, right? You should not negotiate any treaty for benefit sharing. That's what US says, right? When information should come automatically. So when a pandemic happens, health products should move automatically, right? It should not be given to negotiations and mechanisms. That's kind of an enlarged vision for equity needs to be there in the new instrument. Only then that's what we call as, this new instrument could really be really successful. But on the other hand, what do we see? Perhaps this connects to the question, the fourth question on zero draft and other things. I'm not getting out there, but just flagging some of the issues with all sorts of, the kind of struggle the African group puts in both the negotiations. Because I've been seeing the kind of amendments, the wonderful text and assertions they've tried to put up in the HR proposals, along with some other countries like India, Malaysia, Bangladesh. That has a kind of specificity, what sort of actions member states should take in terms of PHEIC triggers, right? But do we have that level of specificities when it comes to the new instrument? And it perhaps, it's kind of, the kind of language use, which is habitual when we think about international law, right? Especially when it comes to duty to cooperate. It's very difficult for lawyers from Europe and America to draft it in a way that it becomes objective, right? It will always be fluid, optional, partnership, collaboration, which cannot really trigger out actions or specify what actions are there. So that kind of a problem would sting around if experts from Secretariat continue to draft every now and then what we want to see as an instrument.
Great,
and
thank you.
then their involvement is seen from the very beginning of the call for the new instrument, which is a little bit shaky and tricky in this whole process.
Gotcha. Yeah, gotcha. Thank you. Laith, please.
Thank you. I'll be very brief, just trying to build on what others have said. I think there is clearly, with the momentum that we have, with the recognition of the problems that has taken place over the past almost 3 years now, with everything kind of building up to this moment, there is clearly an opportunity for all of these kind of great things to happen, within the treaty. Triggers for equity, kind of a broader definition of, all of these kind of concepts of prevention, preparedness, response and recovery, all of these kind of various things. But my concern, and this kind of also kind of elaborates on the thing that I mentioned in response to the first question, is what actually is the guarantee that any of those principles are actually translated into action? That's really the concern that I would then have, right? There is this opportunity, it does exist. There is likely going to be good tech, but then the concern is there is a technical side which needs to be solved for, and there is a political side to be solved for, right? So there needs to be not just the technical solution to the problems that we see, but also the political will and the pressure and the power dynamics shifting in the direction that ensures that the commitments are lived up to. So that's kind of what I meant by focusing less on the governance. I meant the governance in terms of like the technical bit, the actual tech, rather than like governance in its broadest sense. So how do we ensure within the negotiations that we shift power in a direction that makes sure that we do what Nathan was referring to, these automatic triggers, these things that kind of operationalize equity from the get-go, and ensures that states are going to be held accountable for those commitments, right? Like making sure that if a country doesn't comply, yes, sure, we can't force every country to comply, but countries need to there needs to be kind of the bare minimum of, if a country commits to something, there needs to be some sort of mechanism built into the treaty to ensure that it will live up to that promise that it has made. But also, but that's also kind of a question about the broader power dynamics, about making sure that is the kind of only politically salient option for a country, that it does look after its citizens, that the world does cooperate towards equity, that all of these things do happen. These are kind of political problems rather than technical problems. So yes, I think it's a really good opportunity because of all of this background that we've been discussing. But there is the risk that it ends up just sitting there on a shelf, as a lot of international treaties do. So it's about trying to ensure that doesn't happen.
Right.
So that's why. Sorry.
No, please, Michelle, go ahead.
So that's why the independent panel, and to some extent some of the WHO latest proposals on so-called Committee E, but that's why the independent panel said we need this Global Health Threats Council. We need at political level a body that will ensure accountability, because what you're talking about, Leith, is around accountability. And let me just jump on this, because I read a lot about civil society and the role of civil society in the chat. We thought in the independent panel that that Global Health Threats Council, let's call it an equivalent of a Security Council for global health threats, but not functioning like a Security Council with veto rights. But we thought that it would be very high level, at the level of heads of state, but it would also comprise a science component and a civil society component, because global health governance and global health diplomacy in 21st century is multi-stakeholder, as Precious said from the beginning, and it is public. So for all of you who worry about the role of civil society, don't think that it is because it's a group of professional diplomats that negotiates in Geneva that whatever you say, whatever you write, whatever you tweet is not important. You are actually building a movement that is profoundly influencing those negotiations. So keep up.
Can I
Let me, I just want to add, Michelle, indeed, I mean, what is important, and I keep on going back to the country experiences, what happened, because, globally, yes, but also at national level, if those things do not happen, and if you don't have ways of putting in accountability measures, which is what Linth was saying, I mean, we can as well close shop. And I just want to say that in the IPPR report, we actually had recommendations, global recommendations, but we also had recommendations at national level. And I'd like to say that if we want transformative change, we need empowered communities that can be part of the solution, because sometimes when we make solutions, I mean, when we come up with solutions and we make recommendations, we tend to forget that there are communities, like I say, outbreaks start in communities and they end in communities. So our response, as we look at global mechanisms, and we must also look at national mechanisms that are inclusive. And governance should be inclusive, and there must also be means of making countries accountable, but at country level, there must also means of holding government accountable. I just wanted to say that as we look at these, of course, the treaty cannot be an end all be all, and these instruments, you'll have an instrument, you have IHR. The IHR review committee, when the IPPR was meeting, we had three processes that were underway. It identified gaps in IHR. But I think the gaps are also of a legal nature, in that the manner in which the Constitution is written is such that it makes provisions for a treaty under one article, Article 19, and provisions for IHR under Article 21, and provisions for PIP framework under 23. So what the legal people should do is to help us ensure that we can bring all of those together in a manner that works and can show that we can implement at a country level. I mean, social equity to promote well-being and social security for people is key. And I know that we keep on debating. I get a little bit impatient because I say to people, I'm a COVID survivor, you know, but we count 6 million people who didn't survive. So next time around, one of us here will not be a survivor to live to say, let's come up with a treaty. So next time, we should not be discussing, we should say, how well did we implement?
I hear you. I want to, for the sake of the audience, I'd like to say something about the treaty. And just to make sure that we're all on the same page, because I want to make sure we can get into detail, but kind of pull back for a moment. And just for folks to know, right? So in December, more than 180 countries got together, and the talks productively focused, I think, on the issues that we've been talking about. And it concluded with this agreement about another round of negotiation to happen this month in February. And the zero draft just came out a few days ago, right? And I just want to make sure everybody here knows that the zero draft is out. And the idea is for this to result in something that could come before the World Health Assembly in May 2024, and then move into the process that Michelle was talking about what it takes for a treaty actually to become international law. So what I would love is to hear just a brief summary, and we don't have much time, but of kind of what's missing in the zero draft from people's perspective, and you know, what are some non-negotiables from your perspective, and really things that you think everybody needs to be paying attention to, right? Because this is really kind of the moment that we're in. And I guess, Nithin, may I start with you?
Thank you. So that it's moving into the question 4. With regard to question 4, and with regard to what is missing in new instrument, I would say elements, you know, all the elements are there, right? But when it comes to the language being used, it becomes a big challenge. And why is it becoming a challenge is also a big question. I see the kind of same language being reflected in the IHR Review Committee's report as well. So, for example, if I take 6 of the main important issues, call for the health system strengthening, you know, that's what the first thing which I would prefer in both instruments, right? I would see within IHR, the expansion of Annex 1 is one of the most important elements in terms of, you know, understanding what capacities national country governments and the countries should have, communities should have, and then put investments in that. So when that kind of an expansion happens in the new instrument, the RCs comment this like doubtful whether that actually holds into the scope of IHR, whether that scope, you know, that's a kind of a critical question, or kind of putting again a doubt back whether health systems resilience is actually an element in pandemic or emergency preparedness. That doubt is also, perhaps I would see the new instrument. It's the kind of prioritization for surveillance as well as One Health ideas is very clear. So I would still say, if you look back to the eSPAR reports and other stuff, where we see a clear distinction where response capacities lags behind when compared to surveillance or prevention capacities, we clearly know where do we need to invest. But we don't do this. We still keep on calling for complex technologies, AIs, digital health, and One Health. All these are important, but are these the first priority? That's the question, right? That challenge would come back in this. That challenge is coming back in the new instrument aspect. Coming back to finance, both the review committee and the zero drafts recognizes the importance of finance. but they tried to point the discussions towards the World Bank Fund, and which I would actually call a big problematic, because the WHO's technical lead, there are enough reasons to go through the documents, the governance document, and say that their position is really compromised. They really don't have, of course, the name is technical lead, but their activities is not really to prioritize health policies or set up the kind of the requirements required for project proposals and evaluate it. The advisory role is very, very limited. So, and we also need to look back into the history of World Bank funding, which also reflects to the previous question on community health, because once the Alma Ata came, we have seen how UN and WHO has been constantly underfunded. Because of the affinity of Alma Ata towards NIEO, you have a series of articles written by Fiona Godley in British Medical Journal about this kind of, undermining of WHO's central role and pushing the policy back to the World Bank. So the same ideas get reflected in the new zero draft as well as in the review committee report. Next, access to technology. The calls are like, oh, let's not have specificities. Let's not have legal obligations. Let's go for soft law. So that's another problem. Third, is it called for CBDR, which is the fourth issue, that is common but differentiated responsibility, how it could be applied in the new instrument as well as in the IHR. Both the draft, review committee report and the zero draft speaks about using it as a kind of something which people, those who have, give to those who don't have, but do not really recognize the historical responsibilities of the donor countries in weakening the health systems, right? So, which is also a very important issue. And the fifth one is going back to kind of promoting prominence of WTO and its actions on trade and products over health priorities, or specializing or recognizing IHR, a new instrument, as lex specialis in international health, right? Instead of giving back these issues to the WTO. The same kind of prioritization do not see when it comes to Convention on Biological Diversity and decisions taken up there. It's a kind of I would say the logic applied in the case of WTO is not perhaps the one or the same level be applied in CBD. Then the last one, which is on equity, again, I would say, the remarks coming out of the amendments proposals by Bangladesh, by Africa Group, kind of creates a lot of doubts about whether these are operatable, and then ends up with a kind of conclusion that an active mechanism, which is not a legally binding mechanism, could actually perhaps help the calls for equity. Now, we all know that that's not what we really want, either through IHR amendment or through the new instrument. So on these 6 things, I would really say these things are really missing. And when it is missing, there is the problem of creating dependency of developing countries on the funds coming from developed countries, which would rather generate debt further. And those debts would further expand health inequities, which is not very good for preparedness.
Well, maybe I'm triggered to respond and say, actually, I disagree on the finance, and I'll tell you why. Because if you read chapter 5 on finance and Article 9 in particular, I think we've recognized that countries have the responsibility to look after their citizens. This culture of dependency is a real concern. I think if you read the chapter on finance again, is that you're actually saying countries must dedicate their annual budget for prevention, and we're even putting the threshold at 5%, that it must be 5% of the GDP. There's no World Bank there, there's no WHO there. That's national government responsibilities, and I think treasuries must make sure that those investments happen. It cannot be that we continue to perpetuate this culture of dependency and dependency on global mechanisms without making countries invest themselves. Let's look at what happened during COVID. During COVID, where was development aid? What did countries use to respond? They didn't wait. They had to respond using their meager resources. So we've recognized that, and we've gone back to say, let's embed it in this instrument. It is not provided for anywhere else. And I think that's a principle that we must hold, and we must hold dearly. The second is about, I think I can talk about my experience and say, when we had listeriosis in South Africa, that's a foodborne disease. it cannot be that we look at infectious diseases only, and in the meantime we have also foodborne related diseases. So this idea of One Health, it's a European machination and so on. I think it's, honestly, I disagree. And we have to be real about, I'm coming with experience on the basis of what happened in my country, how we saved life, but also what happened in Africa with Ebola. So when we talk, must be based on evidence. It must be based of what the lessons that we had, so that when we come up with an instrument and we talk about investment in human resources, the strengthening of health system, this whole idea of strengthening health system has been articulated even during HIV and AIDS. We said you cannot build a system about a disease. You have to respond comprehensively. You can't build a system for NCDs, a system. This system must respond for all kind of problems, whether you have a disaster that we've seen in other countries. When we had floods in KZN, our clinics, people could not access healthcare. When we had COVID, people could not access they could not access services for diabetes and for other disease areas. So when we build a system, that can respond for all eventualities. And I think what we try to write here is with that in mind. We're not just looking at these, short-term solutions. So our point is investment in human resource for health, and that is well captured under Article 14, because we saw how the frontline workers were compromised. We saw how lack of protection of those health workers. So we are writing it into this instrument that you have to protect the frontline workers. You have to protect the vulnerable groups. And I'll keep on repeating it, because women were the worst hit, and we must not leave the youth behind. Thank you.
Thank you. Thank you. Please.
Can I just add here? First, I would like to acknowledge that I think that Zero Draft contains new and bold language on a number of issues, and it took Precious some people by surprise that it was so bold and innovative. So it doesn't mean that everyone is satisfied with it, and of course, and I still think there are at least three major issues pending. One around finance, and I totally agree with you, Precious. Start with financing at country level. But when it comes to the global level, we in the independent panel said that we should build a fund to which every country would contribute on an ability to pay basis, and not a new fund at World Bank or everywhere that, as Nitin said, would build again this dependency of the low and middle income countries on the charity of donors. So this is where that's still a weak point. The second weak point I continue to believe is governance. I don't see governance at WHO for pandemics that go in terms of issues far beyond just the health sector. And the third weakness, I think, is around the platform, because even if there is bold language and the potential to negotiate IP waivers and so on, the focus is very much on more manufacturing capacity and more equitable distribution, but it doesn't say enough about R&D. And if research and development remain in the hands of a few countries, we will lose the opportunity that is offered to us by the present negotiations to really shake the system and go for something transformative.
Thanks. Laith, last word on this.
Thank you. I agree actually that with the assessment that there is some bold language, that there are some really important, quite ambitious commitments being negotiated. And actually relatively optimistic that a lot of the language will stay in. I think that I think a lot of countries that need this are pushing really hard and will continue to push really hard. And so I'm optimistic about the provisions that will be written in. But I'd like to go back to in terms of answering the question about what is non-negotiable, back to accountability mechanisms. I think that's what's missing in there at the moment. Consensus is going to be really hard to reach, and so there will be some compromises. And so we may end up in a position where not all countries actually want to implement all the different bits. So we really need to make sure that there isn't a hierarchy of commitments in the treaty. We need to make sure that it's not just the things that were going to happen anyway that are going to happen. We need those ambitious things to actually be implemented. And so I think that it's really essential to write in clear accountability mechanisms right from the start. It's been shown through different bits of research that this is the only kind of modifiable kind of design feature in treaties that can improve compliance with it. There are obviously lots of things around socializing the treaty and the political aspects, but in terms of the design feature, accountability mechanisms need to be written in to make sure that that countries actually live up to the expectations and to the obligations that they sign up to. So and that's been a focus, that's been a real kind of deep focus of our work recently. And having reviewed lots of different mechanisms, interviewed lots of different people, what we completely agree with the independent panel recommendation around the idea of a high-level political body to oversee that sits at the high, that is literally at the highest political level in the world that is possible. So engaging heads of state in this. And making sure that also that this body actually receives, and the public, not just that body, but the public needs to receive really reliable information about what countries are actually doing and what they're not doing. And so there needs to be really to kind of attached to that, there needs to be really robust monitoring mechanisms in the treaty as well. These mechanisms need to be independent. They need to collect information from as broad a range of sources as possible. There needs to be, so that it, ensures that there's trusted information flowing in to heads of state, to the public, to enable this accountability to happen. At the moment, the accountability question is being deferred according to the zero draft. It just said that the accountability mechanisms will be agreed at the first meeting of the governing body of the treaty. It needs to be in there from the start. It needs to be negotiated as part of the whole package of commitments within the treaty.
Can I just
Sophia, if I would actually perhaps, because I've been when I said responses where they're curtailing, I would perhaps say three comments to just show what I meant and clarify me. I mean, I've not actually gone against the idea of what Professor Michel or Light was saying about the intensity in which new instrument thinks about it. But three things can I say? So, for example, I'll just stop it.
So please, in 30 seconds.
Yeah, sure, definitely. So when the suggestion for increasing national investment came, the question is, can we actually perhaps give that physical space freedom to the countries by adopting or by asking for a better physical space regulations under IMF? Right, that's an important thing which we need to do. Then going forward, when it comes to discussion about R&D capacities in different parts, are we actually talking about a pre-negotiated benefit sharing agreement? Or we are looking for a mechanism of negotiating benefit share in future, right? So that's the problem, right? We don't want a future promise. Are we getting into a pre-negotiated settlement? The last one on accountability is basically a question is like, why only accountability of states? What about accountability of non-state actors, who are the real actors doing a lot of things within this process? So that should also be reflected in the new draft as well as in the IHRB committee. Thank you.
Thank you. All right. I cannot believe this has been the fastest hour I've ever spent in my life. I don't know about the rest of you, but I'm on a whirlwind in terms of everything that we've done. And it feels that this conversation is just beginning. And frankly, it is. Right. One of the things that I'm really sorry about is that there's some incredible questions that have come in that we have not been able to get to. And I'm very conscious of that. And I apologize to you all, but this was an incredibly dynamic, stimulating conversation. You're all fabulous. And I'm so grateful that you took the time with us to be able to stimulate our thinking and get us thinking. I'm so conscious of the fact, look, this conversation is just beginning, not just in terms of this group, but in terms of where we are. And I really hope folks who are here and are paying attention are saying, okay, this is something we really need to pay attention to. These are people to pay attention to, but this treaty is something we all need to be paying attention to. And so with that, I just want to thank you, each of you, so much for your time and for the fact that you engaged so generously with us on this. This is our next event, but mostly thank you, and thank you very much to the audience.
Thank you.
Honestly, fastest hour ever of my life. Okay, so
Thank you.
Thank you all.
Thank you so much for inviting us. Bye-bye.
Thank you.
Thank you so much.
Thank you.
Really appreciate it.
Thank you.
Bye.
Bye.